Again, I'm Ben Sapol of Theater Delta. We do interactive theater for social change in Chapel Hill, and Doug and I have worked together for a bit of time. So I think with no further ado, we're going to go ahead and jump into our first role play. We're going to have a doctor, and we're going to have a patient from Nigeria. And again, Doug just said the format, but the idea is you're going to watch this vignette, and then we're going to have a discussion, and we're going to ask you what came up for you and what you noticed, and we want to hear from you. You're as much a part of this as we are. So, role play number 1.
Hello, I'm Dr. Drossman. How can I help you?
Hi, Dr. Drossman. I'm Ademola Aderoju.
Ademola Aderoju?
Yes.
I couldn't quite pick up the accent. Are you from Africa?
I'm from Nigeria.
Okay, I guess I can't always tell the accent. Sorry.
Yeah, that's all right. Some people think we all sound alike, so that's fine.
Okay. How can I help you?
Well, I've been having this problem with my stomach, and I've seen so many different doctors, and they've not been able to help me. And one of them said I should come and see you, that you'll be able to get it fixed.
Well, I hope I can help. When you say your stomach, can you say more about what your symptoms are?
Well, it's kind of like a heaviness I feel in my stomach. It's been bothering me for so long, and it's
heaviness. I mean, do you mean like pain or bloating or nausea?
Yeah, I guess you could call it that. Yeah, probably pain.
Pain? Is it bad?
It's terrible.
Okay. How about when you eat? Is it worse with eating?
Yeah, it gets worse when I eat.
Okay. What about your bowel habits? Do you have any problems with your bowels?
Yeah, sometimes.
Sometimes? I mean, do you have diarrhea or constipation?
I guess you could say probably a little bit of diarrhea, yes.
Okay. Diarrhea, is it bad?
Yeah, it can be bad.
I mean, is it so bad that you might not make it to the bathroom or have incontinence or something like that?
It kind of depends.
It depends? Are you having incontinence or not having incontinence?
No, I wouldn't say so.
Okay. Well, so you have abdominal pain and it's worse with eating and you seem to have some bowel problems. What do you think is going on here?
Well, I don't know. I'm not sure. I wish I knew. I mean, my mother has her ideas, and she thinks it may have something to do with the food I'm eating, because, I have always lived with her, but recently I moved out to live with my fiancé. And my mother always cooked for me, the traditional foods and things like that. But my fiancé is now cooking different foods, so my mother thinks that it has to do with the change in my diet. So it may be that. I don't know. She actually didn't want me to come here and see you, Dr. Drossman. She actually thought that this may be something else. She wanted to take me to church and have some people pray for me and things like that. But my fiancé, they had a big fight about this, and I just decided out.
So I guess I want to understand what you're thinking is going on.
I wish I knew, Dr. Drossman. That's why I'm here to see you. I was told that you would figure it out.
Well, okay. Well, from the records from the outside, you've had a pretty good workup. We're going to do a physical exam. I think, it sounds like irritable bowel syndrome.
Oh, really?
Yeah, I think that's what it is. And we may or may not do other tests. But I want you to know that we can help. There are treatment options. There are things like, if you're having diarrhea, we could give you something like loperamide. We'll talk about that later. And sometimes we use an antispasmodic.
Okay.
Which kind of reduces the spasm. I don't know if you have a preference of which you might want to consider when we're done.
Well, I just want whatever is going to get this fixed. So you tell me what I need to take, and I'll take it.
Well, sometimes we use probiotics too. Probiotics are very helpful for the bowel to settle the stomach and all of that. And we can add that to the others. Are you looking at combinations where we could work with that?
If you think that's what I need to do. whatever you ask me to do, Dr. Drossman, I will do. I just want this to go away.
Okay.
I mean, my life has fallen apart.
Okay, I know you also said that you had a lot of pain, and I think one thing that we're doing these days is using antidepressants to help reduce the pain. It affects the nerves in the gut to reduce the pain, and that's an option we'll consider as well.
Antidepressants?
Yes.
I don't think this has anything to do with depression. I'm not depressed. This is my stomach.
Well,
I came here to see you for my stomach.
Yeah, I wasn't saying that you were depressed. I'm sorry if I got that point across. It's more for the pain.
Yeah, but why would I need to take antidepressants if I'm not depressed? I just want this to go away. I want this feeling in my stomach. I need that fixed.
Okay, well, maybe we'll just go ahead and do the physical, and we'll talk more about the treatments later.
Okay.
Great. So now we turn to you. What did you notice in this interaction? What stood out for you?
Not enough time. After 4 minutes, you interrupted me. I mean, you didn't let him finish his story. After 4 minutes, you interrupted him.
Okay.
It was a lot.
For
12 seconds.
Great.
And you watched your watch.
You can write it down. Interrupted.
And that's it. I mean, I noticed that you don't have much time for him. You want to conclude. You want to offer some.
Okay. Great. We have another comment. Yes, you may. Absolutely.
I had the impression that the doctors are just hesitating. Maybe we'll give this, and the patient said, "No, you whatever you want, you give it." He said, "Oh, no, but you were consulting the patient some moments, and you immediately knew the diagnosis. You have IBS. Like you didn't."
Great. So one thing we might be noticing is we might have a situation where the doctor is trying to work with a patient and give them options, but maybe the patient doesn't want that responsibility, is kind of putting that back on the doctor. Might be possible as well.
I noticed that the doctor tried to know the meaning that the patient gives to his illness, and as the patient doesn't know at all, the doctor tells him that afterwards we'll see the drug, the prescription, and the treatment, but that's IBS, and he has to go with the IBS. I mean, it's difficult because it was a short time.
Sure, and recognizing it's an imperfect exercise to represent role plays in 4 minutes, but I do want to kind of underscore something that you said, that it just jumped, actually it just flew right out of my head. So let's go to Max for a moment. Oh, gosh, this is wonderful. This is the spirit we want.
One thing I noticed is that was no effort from the doctor to explain to the patient what was going on. He jumped for the prescription before explaining what's a kind of mechanistic approach for the prescription.
So you all are noticing wonderful things. I want to redirect a little. I'm wondering if you notice specific cultural differences on the part of the patient. Great.
With a story about his situation between his mother and his fiancée.
Mm-hmm.
And there was no attitude or not corresponding about the situation. And then he was speaking about his mother tell him going to church, and he said that he's suffering from food, and there was no attention to this
to this thing. So
this story.
And that actually reminded me exactly what I wanted to say, that maybe there's a difference in cultures where in an African culture the medical interview lasts longer and is more social and involves more stories and sharing, and maybe more the Western model is again more to the point, gathering information, and you throw in yet another cultural difference, which is noticing that superstition and the church and belief systems might play into it as well. Someone's fighting for the mic over here.
One question. In what settings Dr. Drossman working? It's in 10 minutes medical consultation.
Good. So I think we're in. This is
what is
again
the setting
an imperfect
you're working?
tertiary care. I think we're in a tertiary.
How many minutes do you have in your agenda to?
Oh, well, let's assume it's could be a primary care practice with his 10 minutes or 15 minutes.
Right. And again, we still have the physical exam to go, and we do have more interaction to go. Focusing on some cultural stuff?
I don't know if it's cultural, but at least he doesn't accept the possibility of using antidepressants. And for me, that's important.
Right, so antidepressants came up, and our patient had a very strong reaction to those that didn't seem acceptable on any level. Mr. Aderju, how did you feel this interaction went?
I felt very uncomfortable because the initial interaction for me was negative because I walk in and he says, "Oh, you're African," which to me is a huge generalization. And then he said, he heard my accent and things like that. So I tried to correct him and say, "Look, actually I'm a Nigerian, I'm not African." And then after that, I just didn't feel, I almost felt like he was imposing his own idea of what he thinks the illness is. He wasn't listening to me. The things that were important to me, my social context, my family, my mother, my fiancé, he didn't make any reference to those at all. So I just didn't get the sense that I was engaged.
We're looking for suggestions on how to improve this medical interview.
In order to understand the patient in the sense of asking him many things. What about his context, his family, his feelings, what's the problem in the present, when the symptom became, many things.
So there seems to be a call for a little more time, to spend a little more time with the patient, but also spend time listening to him and maybe somehow validating his concerns. Great. Other suggestions? And please, if you all want to participate in the back, I will easily walk the mic back there. We would love to hear from you as well.
Maybe we should suggest therapy after we check the patient, and not even you do something, so why do you check? If you want to immediately give the therapy, so don't do the physical.
Okay, so are you talking about withholding diagnosis until after?
And therapy after you check the patient.
And therapy, great, wonderful. Other suggestions?
You understand that the patient is very nervous and he can't explain and express himself correctly. And the relationship between the doctor and the patients are not good. You feel a kind of stress, a kind of pressure. Tension. So I think you have to back up a minute, and to try to understand him again, listen to the story again, and try to understand that the problem is probably related to stress, the relationship between the fiancé and the mother. Try to investigate it more about this, and and try to get his confidence again.
Great. And just as we're thinking of a few other suggestions, I'm just curious. We did notice, you did point out that Mr. Aderju was very hesitant to share his symptoms. Very hesitant. Didn't want to share, didn't have words for them. Why might that be?